Hi, my name is Dr. Rich Hilsden, and you're watching my channel, Knife Skills. Today, we're doing a special video. It's going to be quick, maybe a little less edited than I usually do, because HAILEY Bieber has provided us an update regarding her medical crisis that she had in March. If you're a regular to this channel, you would have watched the live with Tommy Chan and myself, where we break down what we think was likely going on with HAILEY Bieber at that time. So I'm going to put a link right up here right now. You can take a look at that video in its whole entirety if you'd like to find out more about our thoughts on HAILEY Bieber's condition at that time. Our conclusion in that video was that the most likely thing that was going on was that HAILEY Bieber was suffering a migraine. It's super common to have neurological symptoms from migraines in that age category. However, what is great today is that HAILEY Bieber has provided us with an update on her medical condition. And it turns out she truly had a TIA, or a transient ischemic attack. I want to very quickly review HAILEY Bieber's video and just highlight a couple quick points to add additional explanation for my audience and those of you who come to this channel to get my take on some celebrity health events that we talk about on a regular basis. The other thing that I want to do is promote a live that Tommy Chan and myself are going to be doing this weekend. At the time of recording this video, I don't have the specific time, so check in the description below. We'll know exactly when the time that we're going to be going live, and I'll place that in the description. If, though, you're watching this after we've done the live, then there'll be a fresh link up here linking to that video. I strongly encourage you, if you're a viewer, to come on live. We're a small channel and we actually do a great job in answering any questions that you may have. If there's something about HAILEY Bieber's condition or something related and you have a question, we would be happy to answer it live. Our goal is to educate and communicate and bring this complex medical topic down to really something that everyone can understand. Let's dive in and check HAILEY Bieber's video.
Hey, it's HAILEY, and my voice is a little gone. I'm making this video because I wanted to tell this story in my own words of just where I've been at health-wise for the last month and kind of what I've gone through and what the story is here. I think, as some people know, a lot of people know, or you may not know, I had like a very scary incident on March 10th. Basically, I was sitting at breakfast with my husband, having a normal day, normal conversation, and we were in the middle of talking. And all of a sudden, I felt this really weird sensation that kind of like traveled down my arm from my shoulder all the way down to my fingertips, and it made my fingertips feel really numb and weird. And I was sitting there and I was kind of going like this, trying to figure out like what the sensation was and where it was coming from. And Justin was like, "Are you okay?" And I just didn't respond because I wasn't sure. And then he asked me again, and when I went to respond, I couldn't speak. The right side of my face started drooping. I couldn't get a sentence out. Everything was coming out like not even jumbled, just like couldn't get any of the words out. So obviously immediately I thought I was having a stroke, like a full-blown stroke. He thought I was having a stroke, so right away he asked for somebody to please call 911 and get a doctor.
First of all, I think that was great. This is a situation that you don't want to sit on. I think a lot of people in the lay community sometimes hope that it'll go away. In her case, her symptoms were starting to resolve, but they recognized that this was something serious. So good on HAILEY and Justin for getting help. I'll put a link down below of the heart and stroke guidelines for identifying a stroke, just so everyone who's watching this is familiar with what to look for in this event.
The scariest moment of my life, I had so many things running through my head. The number one thing being, I'm having a stroke. I'm really scared. I don't know what's going on. I don't know why this is happening. Am I gonna have permanent issues from this? Like, so many things were running through my head that were really freaking me out and really, really, really scaring me. The facial drooping lasted for probably like 30 seconds, maybe a little bit more. I couldn't see myself, of course, so I don't really know, but I do know that it like subsided fairly fast. And so they were asking me questions, and do you know where you are? Do you know your name? And I knew all of the answers in my head, but as soon as I would try to say it, I just could not get it out. It was like my tongue and my mouth just could not form the sentences and the responses. So obviously that was really, really scary. So I got up. I could walk totally fine. At that point, it was really just like the speech issue. Went back to my house, waited for the ambulance to come. At that point, speech started to come back a little bit. Got in the ambulance to the hospital. There was actually a funny moment where they were calling into the hospital to explain what they were bringing in, and they were like, I have a 30-year-old female, and I was like, I'm 25. I had to make sure that they weren't going to age me 5 years for no reason, you know? But by the time I got to the emergency room, I was pretty much back to normal, could talk, wasn't having any issues with my face or my arm. They did like the stroke checklist in the emergency room, and I scored a 0. I wasn't having any symptoms anymore. So basically, they did some scans, and they were able to see that I had suffered a small blood clot to my brain, which they labeled and categorized as something called a TIA.
It's great that she had no neurological symptoms when she made it back to the hospital. So that's a good sign. Sounds like her symptoms only lasted 30 seconds to maybe a minute or more, and she was back to total normal neurological function when she was evaluated. So that's really important for the outcomes in this situation. She mentioned that it's a TIA. So TIA stands for transient ischemic attack. And we talked a little about this in our video where the question is it truly transient? Yes, indeed. She returned all of her normal neurological symptoms, which is great. But whenever there's, some impaired blood flow to the brain, there is always concern that there could be even undetectable, but some actual injury that's longer term. And that really is what they likely saw on that CT scan or MRI that showed there was an area where there wasn't really a great blood flow to that part of the brain.
And then I didn't have any more issues for the whole rest of the day and the whole rest of the time that I was in the hospital. I felt really thankful and grateful for that it wasn't worse. I wasn't going to have any permanent issues, but, my scans did show that I had a lack of oxygen to a certain part of my brain for a certain amount of time. Still definitely really, really scary. So when I was in the emergency room, they kept me overnight. They did tons of tests. They did blood tests to see if I had a clotting disorder or if I had an autoimmune disease, or they did everything. And anything that they could think of, they did. They also did a certain test called a bubble echo, which is when they do an echo on your heart and they take saline and they kind of, I don't want to say shake it up, but they make it so it has bubbles in it.
They exactly shake it up. We call that agitation in medicine, but it's just a fancy term for shaking. Usually we use 2 syringes and kind of push them back and forth with some air in it, and then it'll create these nice fine bubbles for this test.
And they put the bubbles in your vein to see if you have any bubbles escaping out of any part of your heart. And what they're looking for in that test is something called a PFO. Basically what a PFO is something that you are born with, and typically at birth it's supposed to close on its own, except sometimes it does not. And it's a flap that's kind of like this between the right and the left chambers of the heart. So when I was in the emergency room, they did this test. They didn't see anything. They told me that I didn't have a PFO. So the next day I was discharged and I went down to UCLA to see some more doctors to do some more thorough, in-depth testing.
Let's talk a little bit about a PFO. I thought actually Hailey did an excellent job at describing what a PFO was. You need to understand fetal circulation to understand what a PFO is. So when you are in the uterus, oxygenation comes from the placenta through the umbilical vein. This is where you get oxygenated blood. Now, this is a venous system, and you need to have that oxygenated blood pump into the arterial system. So arterial system essentially are vessels that pump blood away from the heart, and veins are vessels that pump blood towards the heart, generally speaking. And so you need that oxygenated blood to enter that arterial circulation. So the fetus has a few different ways of bypassing the lungs, because when you're a fetus, the lungs aren't doing anything. There's no oxygenation happening in the lungs. So this oxygenated blood comes from the umbilical vein into the inferior vena cava, and you can see that it enters this is the right side of the heart called the right atrium. That's the venous side of the heart on the right. And you can see that in normal fetal circulation, the blood is flowing from the right atrium into the left atrium. And that allows it to enter the arterial circulation and oxygenate the baby or fetus's tissues. Now, a couple little interesting things. Hailey's exactly right. There's a flap of tissue that exists that's present in the fetus that is open because the higher pressure system is this venous side where blood is flowing into the arterial side or into the left side. So there's a right to left shunt happening in the fetus. Now, when the baby is born and takes its first breath, the lungs expand, and all of a sudden, that right side becomes a low pressure system. That causes increases in pressure on the left side, and that pops that flap closed and covers the Foramen Ovale. That's the name of that hole. And it pops it closed, and your left and right heart no longer mix. The right side now pumps blood into the lungs where it gets oxygenated. It returns to the heart on the left side, and then the left side pumps the blood to the rest of the heart to deliver oxygenated blood to the rest of the body. Now, there are other ways things mix as well. There's also something known as the ductus arteriosus. Okay, that's right here. That's another mixing, again, between the arterial side and the venous side, essentially. And so there's other ways that things mix. And so you can actually have connections between the arterial and essentially the pulmonary arteries and the aorta if the ductus arteriosus remains open as well. But that's not what she has. She has what's known as a patent foramen ovale. Now, a couple other things that are really important to understand. Patent foramen ovales occur in just over 1 in 4 people. Hailey Bieber's going to talk about her situation. She had actually what's known as a large PFO. It's much less common and more likely to require treatment. It's important to understand that not everyone with a PFO requires treatment. Not everyone with a PFO is going to have any symptoms at all because the artery side or the left side, I should say, is higher pressure than the right side. Very rarely do blood flow from the right side into the left. But what happened in Hailey Bieber's case, and we're going to learn about this a bit more as she talks about it, she had some kind of clot on that right side of the heart that traversed the foramen ovale, got into the left side, and ended up ultimately in her brain. One little thing they taught me in medical school is what does the lungs do? Well, one of the things the lungs do, in addition to oxygenating the blood, the lungs provide a filtering mechanism to prevent clots, because we get clots in our venous system, small, tiny clots all the time, little air bubbles, depending on the situation, in the venous system all the time. And they get filtered out by the capillaries in the lung before they'd ever get to the brain. That whole system, though, is upset when there is a patent foramen ovale.
Because at that point, they didn't really have an answer or a conclusion for why this had happened. They did come to the conclusion of why they think I had a blood clot in the first place. And the conclusion that all of the doctors came to was 3 different things. One was that I had just recently started birth control pills, which I should have never been on because I am somebody who suffered from migraines anyway, and I just did not talk to my doctor about this. So ladies, if you suffer from bad migraines and you plan on being on birth control pills, make sure you tell your doctor, because having a stroke is a potential side effect from birth control pills.
Quick pause. Dr. Tommy Chan and myself did an extensive discussion on this issue. Absolutely important to talk to your doctor if you have migraines. Now, just because you have migraines does not mean that birth control pills are inappropriate for you. Depends on the dose of birth control and the type of migraine that you have. And again, take that look at that link above here where Tommy and I discuss this issue.
The second thing was I had recently had COVID, and that was something that they thought was a contributing factor. And then the third thing was that I had recently gone on a really long flight. I had flown to Paris and back in a very short amount of time. And I slept through the whole flight both ways, didn't get up and move around, never thought about wearing compression socks. So they still didn't know necessarily how the blood clot traveled to my brain. So when I went down to UCLA, we did some more in-depth testing. And when I went there, they did something called a Transcranial Doppler, which is basically a much more accurate test to find a PFO. And what they do is similarly, they do the saline with the bubbles, they inject it, but with this test, they listen for the sound of bubbles escaping in the heart. If they don't hear anything, presumably you don't have a PFO. If they hear a little bit, you might have one, but it's small. And if they hear tons of bubbles escaping, you have one, it's probably large. So I did this test and they actually found that I had a grade 5 PFO, which is the highest grade that you can have. So mine was fairly large. The conclusion was that I had a blood clot that traveled into my heart, and instead of what typically happens if you have a small blood clot is that the heart will filter the blood clot to your lungs and your lungs will absorb it because the lungs are so big and they can handle it. What happened with me is my blood clot actually escaped through the flap or the hole in my heart, and it traveled to my brain, and that is why I suffered a TIA. So the recommendation from my doctors at UCLA was to have a procedure done called a Pfo Closure, which is when they go through your groin, through the femoral vein in your groin, and they travel up to the heart, and they put this small little button, it looks like a little button, that buttons close the flap in the heart, and then eventually your heart tissue grows back over the closure device, and that's it. And then you have it forever and you continue on with normal life. So
I think this is absolutely interesting. When I first started my training, an endovascular approach to treat a PFO didn't even exist. And technology has now improved that she can have a minimally invasive approach to close a PFO that would have previously required open heart surgery. Totally awesome.
So I recently got the Pfo closure done and it went very smoothly. I'm recovering really well, really fast. I feel great. Now that it's all done, I feel so much relief and I feel just so grateful to all of the doctors at Eisenhower Medical Center who took care of me, all of the doctors at UCLA who took care of me. That's my story. That's what happened. If there's anybody that watches this that has gone through the same thing or something similar, I definitely really empathize with you, and I understand how life-altering and scary it is. And if there's anybody out there who sees this and has maybe experienced similar things but doesn't really know the reason or know why, I would definitely encourage you to talk to a doctor. And yeah, so this is what happened, and thanks for watching.
Well, I want to say thank you to Hailey Bieber for sharing this story online. I think she did an amazing job at explaining really what her experiences were and the medical issue of this PFO, or patent foramen ovale. I think people can learn a huge amount just from that 12-minute video that Hailey explains this common and rarely serious condition. Usually it's totally benign. Usually it's not a problem. The vast majority of people with PFOs will never have an issue. But I'm excited to talk to Dr. Tommy Chan later on about her symptoms, and I've got lots of questions for him. I'd encourage you to keep an eye out for that live video that'll be coming up. You can come on and ask us questions, and we'll happily answer them. I even have a question for Dr. Chan already. She mentioned that she had migraines prior to the diagnosis of this PFO. My question to Dr. Chan would be, if someone has a PFO and they have migraine symptoms, what chance are some of those migraine symptoms actually related to the PFO? Is there a mechanical reason in the heart that she was having migraines before, and can she expect or hope for at least a change in her migraine symptoms now that her PFO is treated? So that'll be a question for Dr. Tommy Chan this weekend when we discuss Hailey Bieber's stroke-like symptoms. My name is Dr. Richard Hilsden. You've been watching my channel, Knife Skills. Thank you once again for sticking around and supporting me. I would encourage you to like and subscribe, and that'll allow you to actually get that notification that we're going to be going live and give you an opportunity to connect with myself, Dr. Chan, and discuss this issue of a mini stroke. and a patent foramen ovale. Have a great day.